Good afternoon, everyone. We have quorum. I would like to now call the Board of Health meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may be audibly or visually recording this meeting. Electronic devices, please, are to be switched to a non-audible function during the meeting. Madam Clerk, are there any changes to the agenda?
Yes, Madam Chair. There are added delegation requests. Added items 6.3 through 6.13 are all for a future meeting respecting pollution surrounding the Parkview community from the following people: Elsie Briggs, Parkview Community Association; Iveta Morin, George and Eddie Bellamy, David Kebeck, Brian Beck, Terry Morris, James McDonald, Maureen White, Gabrielle De Silva, Maurice Medeiros, and Nolly Baying. Added item 6.14, which is Brody Robbenmeyer, respecting climate change for a future meeting. And note that the copies of presentation for item 9.1, Ontario Health Team Update, are included in the changes package.
Thank you, Madam Clerk. May I have a mover and seconder? Sorry, there is a request to speak from Councillor Whitehead.
Can I ask for clarification, because climate change, maybe it's all encompassing, and when you have a delegation request coming forward, some of it's infrastructure, some of it's such a broad topic, and I'm trying to understand what it would be I would think that the central depot for climate change would probably be GIC committee versus public health, because it's all encompassing. And I'm just sort of getting a little frustrated that we're getting so many of these kinds of requests at public health when it's probably better managed at the GIC. So I just want to, since that's on here, I would suggest that we forward over to clerks on GIC and have it part of the GIC consideration, which is much broader in the context of dealing with these kinds of issues than public health. So on the climate change one, I would like that referred to the GIC.
Councillor Clark.
He raises a valid point, because we don't really have the staff here that actually handle a lot of the files that would be a part of climate change discussion. I'm seeing nodding heads from my favorite front row. So we may just want to defer all climate change decisions over to GIC, and then public health and community and social services can comment on it when it comes before GIC and through the senior leadership team. I'm just looking to Mr. Johnson and Dr. Richardson if that makes sense. From a governance perspective, I think we can do it politically, but if it's from your side.
We'll go to Mr. Johnson, but before that, my understanding of when we were deliberating the climate emergency, there was direction to park that park that initiative, park that corporate exercise with GIC in terms of reporting. But Mr. Johnson.
Yep. Through the chair, you're 100% correct. The new structure we have for the corporate climate change task force work, which Jeanette actually oversees, is coming to GIC for its regular reporting. And as such, I think it would be perfectly legitimate to say that those delegations then can go to the right place. Otherwise, we'll have to bring certain members as needed to this committee, which may get more complicated when we get generic requests to talk about climate change writ large.
So then I think we should ask Madam Clerk in terms of how we would deal with these requests today.
Madam Clerk.
Through the chair, for item 6.14 specifically, once we get to the delegation request section, we could refer it to GIC at that point. Are you wanting to do the same for all of them, for 6.1 to 6.13 as well? Just 6.14 was my understanding. Is that correct?
It's just the one that makes referral to the climate change from my perspective. The others are a little different. They're not.
My understanding is Councillor Merola will be speaking to it at the time. Or would you? I think it would probably be prudent for this Board of Health to approve, and then we can have that discussion subsequent. Okay? Thank you. So with that in mind, may I have a mover and seconder to approve the agenda as amended? Electronic vote, please. That was moved by Councillor Clark and seconded by Councillor Vanderbeek, with the notation that 6.14 will be heard. But we'll deal with that then, okay? Electronic vote, please. My hair product that. Thank you. Declarations of interest. Are there any declarations of interest this afternoon? Hearing none. Approval of minutes of the previous meeting, July 10th. May I have a mover and a seconder to approve the minutes of July 10th? Do you have a comment or a mover? Okay. Councillor Pearson, move. Councillor Pauls, seconded. Electronic vote, please. On the minutes. That carries. Communication items. Communications items 5.1 and 5.2 are before you. Are there any changes to the recommendations that are set out there? Good. If not, I'll have a mover in Councillor Pearson. May I have a seconder? Councillor Vanderbeek, thank you. Electronic vote, please. That carries. We now have items 5.3 to 5.6 to be received. Are there any changes to the disposition of any of the communication items? Show of hands, please, to receive the correspondence. Thank you. Delegation requests. We have 13 delegation requests for a future meeting respecting the Parkview community. And it's my understanding that Councillor Marula would like to speak to this matter.
Thank you, Madam Chair. And this is one of those classic provincial jurisdiction issues and chaos that is created in the community as a result of a lack of enforcement and lack of understanding of the province of their legislation and how it impacts quality of life. So what we have before us is a number of delegation requests, and people are so frustrated by the province, they have no idea where to turn to, so they turn to the city. And it is another form of downloading. And in saying that, even though we submitted a petition on their behalf just a couple of months back, the petition clearly outlined all of the concerns, and we submitted it into Queen's Park. The member of provincial parliament has indicated that as a result of the House not sitting, that petition can't be submitted. Knowing that they're in opposition and knowing what Premier Ford has stated, their commitment at present is to actually review not having any enforcement within a certain radius of an industrial core. And just recently there was an announcement to that effect, and there was an article that was in the Hamilton Spectator accordingly, and it really does become a, I guess, class warfare in the sense that they enforce environmental laws in areas outside of the industrial core, but they won't enforce those laws within the industrial core. This is not a new problem. This is a problem that I inherited when I was first elected in 2000. Mike Harris in 1995, about 96, 97, he changed the provincial legislation through the Ministry of Environment to go from having mandatory legislation to voluntary. And there was a series of changes after that made the enforcement branch of the Ministry of Environment more consultative as opposed to an enforcement branch. So most people, when you say Ministry of Environment enforcement, so all the complaints that I've received in this community of Parkview over the years, I submit to the Ministry of Environment as a complaint. So I think most people think that when you put a complaint into an enforcement branch, It's like calling the police, right? The police come out, they investigate, they find the evidence, and they lay charges. It's far from that. What they've created is a complaint system that comes in. Normally, they won't respond till days later. There aren't, I don't believe, any enforcement agents, even within the city of Hamilton. They're coming in from out of town. They then go out to try to source the complaint, whether it be soot or any other issue. And then they come back, and I think they have like a rubber stamp response and saying, we can't source the issue, and there's so much industry that we can't conclusively say if the complaint's legitimate. In 20 years, I've heard that 1,000 times, if not more. So the only time we ever got traction was with Columbian Chemicals, and it was because we had a law firm come from Arkansas who reached out to me after some news clippings or news related to the fact we were going to vigilantly go after Columbian for the carbon fallout. And this law firm, at their own expense, came here. We set up shop at the Sheridan, brought residents in. We had, I believe, over 100 people sign on to the class action lawsuit. This particular law firm had set up initiatives in all over North America and Europe even, because Columbian Chemicals is a pretty sizable corporate entity. And within a year and a half to 2 years of that process, it was remarkable how quickly Columbian Chemicals cleaned up their act to such an extreme that they actually came here and we gave them an award, a business award, for how much of an investment, literally capital investment, they made based on that. Don't kid yourself. If they could have gotten away with it and continued doing what they were doing, they would have. But because their shares were being impacted, because of the triple bottom line, and now it started hitting their bottom line, they reversed their trend and they made the necessary correction. And since then, they've never been a problem. I wish other corporate entities would do the same. Unfortunately, we have some smaller entities that doesn't matter. Public relations is irrelevant. So they continually doing this as a cost-saving scenario. The company at hand here, and I'm going to name it because all the complaints come in from them, about them, is AIM, which is a scrap yard. American International Metals, I believe it's called. And they function 24 hours a day, which creates noise, odor, dust issues that are quite profound. And you will hear the backing up of tractors, you will hear the machinery. It is loud and it carries, particularly at night, and particularly because it's by the water, there's a relevance to that and noise carrying. So hundreds, if not thousands of complaints come in, they go to the Ministry of Environment, and nothing changes, hence the frustration that they're experiencing. So most recently, I spoke to a number of them, one in particular yesterday, and even after we submitted the petition, I asked them why they were doing this, considering we were waiting for a response from the province. They're saying because the House is not sitting. It's not till the fall. But the last thing I want to do is have 13, 14, or 15 residents come here, receive their delegation, to only then refer to staff, for staff to report back and tell them it's a provincial issue. So I'm not going to go through that dog and pony show for headlines or politics. I'm going to be straight up with them and say, it's a provincial issue, which I've done. But I do have an avenue I'd like to pursue, and that being utilizing this as an opportunity to truly have a meeting with the community at the Museum of Steam Technology, to have our staff, the Ministry of Environment, and invite the MPPs. Hopefully they'll attend. Last year when I initiated the Environmental Air Quality Seminar, they arrived, they showed up. It was an election year. Let's see if they show up this year. And really have it out with respect to what the presenting problems are and whose jurisdiction it is. But saying that, and even saying that, a lot of people don't recognize that even though it's not within our jurisdiction, a lot of these issues, we have gone over and above in many ways and even impacted our general levy with respect to combating air, dust, and odor issues in the industrial core, which, as you know, runs from Stony Creek all the way basically to Dundas, let's say. And so I'm going to, through you, Madam Chair, ask Kevin, just brief synopsis of the last 20 years, and knowing the frustration that this city and all municipalities in Ontario have been subjected to. over and above what I've just stated, can you just give a brief analysis from your end, from your expert point of view, on what the presenting problem is and how we're going to go about communicating a course of action?
Right.
Mr. McDonald?
Through you, Madam Chair. Thank you very much, Councillor Marula. You've summarized, I think, the chronology very well. You're intimately involved with it and aware of the issues that are facing your constituents. Certainly from my perspective, given my limited amount of time on the file, Hamilton stands out provincially among a rare few that are very progressive and active on the file of air quality. Here in Hamilton, we, Public Health Services and some of our corporate counterparts have been actively involved with key stakeholders, including McMaster University and others, as it relates to Hamilton's clean air quality initiatives, most notably Clean Air Hamilton. You will all be familiar with Clean Air Hamilton. They report to the board and council annually with a report as to the health of Hamilton's air. They will once again be before the board later this year. We will have an additional report as well from ongoing work that we are doing around Hamilton's airshed model with Golder and Associates. I think early on in this term of council, Anthony from Golder Associates presented the Hamilton airshed model, which is a fairly novel and innovative approach to understanding this community's airshed. We were directed by the board at that time to go away and do some further work on some sub-region analysis as it impacts various neighborhoods in close proximity, specifically to our industrial corridor. That work is going on. And we're also collaborating and doing some additional work with Public Health Ontario to understand the correlation and attribution around morbidity, mortality as it relates to air pollution exposure in this community. So in that regard, Hamilton has been very progressive you know, given the situation that we find ourselves here in the city, has taken a proactive approach to not only communicating, but trying to understand what air quality means for the larger health of the community. In terms of going forward, I think you're absolutely right, and you've pinpointed that from what I can determine from these delegation requests, much of what people are seeking some information or soliciting some sort of grievance for is largely within a provincial jurisdiction, and our office would certainly welcome the opportunity to work with you and work with the MOECP, which is the Ministry of Environment, Conservation and Parks, to facilitate and participate in a meeting to address the issues that are before us.
Okay. So through you, Madam Chair, and I thank Kevin for that. One issue that I think we do have some degree of jurisdiction or control over would be a public works item, and that being something that I did a couple terms back with respect to increased street sweeping. And I couldn't get general levy operational money, but what I did is I paid for it through my area rating. But because it was operational, I could only do it a one-time basis. But my question, I guess, at this point would be, because it's a new term, can I do it again? And I'm gonna seek that out, that answer out, because if that's the case, I will do it again, particularly in this particular area, and then try to work to try to get operational funds perpetually accordingly. But having said that, that's the only aspect I can think of. And there's other potential issues such as trees. I know some people are asking for a wall, but I think our staff have indicated that the wall would have little impact on mitigating some of these issues. So again, these issues will all be dealt with at that community meeting. So at the appropriate time, I'd like to move that the staff be directed to work in partnership with the Ministry of Environment, the local MPPs, and the Parkview Community Association to establish an environmental community meeting of Parkview at the Museum of Steam Technology, and that we receive the requests for delegation that's on the agenda today, and that's seconded by Councillor Collins.
Thank you, Councillor Marula. Councillor Whitehead, you want to speak to this?
Yeah, I just want to identify another thing that Councillor Miller championed, and that was the air monitoring from the city, because the MOE didn't have enough of those monitoring stations. So I knew both is an attribution to your concern about the air quality in the area and looking for more monitoring stations to again monitor the air quality in that area. Thanks.
Thank you very much. So, Madam Clerk, can we just have a show of hands to indicate that we are in favor of receiving the delegates, 6.1 to 6.3, and then have a motion with respect to Councillor.
So through the chair, the motion would be to receive the delegation request and direct staff to have a community meeting at the Museum of Steam and Technology and invite Parkview community residents and local MPPs, as well as the Ministry of Environment. Public health staff, yes, correct. Yeah, so could we have an electronic vote on that, though?
Does everyone understand the motion? We can have an e-vote on that now, please. It's moved by Councillor Marula and seconded by Councillor Collins. Thank you, that carries. We're going to the delegate request of 6.14, and there has been some discussion on this already, and I think the direction.
Move it to the delegation request to GIC.
Can we have a seconder for Councillor Marula? Madam Clerk? Okay? Have an e-vote on that? Yes. Thank you. So it's up for
The conversation we had, it was beyond just this particular request. It was basically the principle of any delegation request that comes to the Board of Health would automatically be told that you need to make that request to GIC. The GIC would be the central depot for all climate change delegation requests. So it was more of a formal piece. Is that a separate motion I would need to put forward?
Madam Clerk?
Through the chair, no, it will be fine to refer it to GIC, and then they can go from there.
Okay. Okay, thanks.
I think that's understood by the clerk and by everyone around the horseshoe. So could we have an e-vote on that, please? Grand. Consent items. May I have a mover and seconder to receive the minutes of the Food Advisory Committee? Show of hands. So moved. Great. Staff presentations. We have Mr. Paul Johnson is here. He's going to give a presentation of the Ontario Health Team update, and he is joined by some friends from the community, I know, which he will introduce in time.
Yes, thank you.
Mr. Johnson.
Through the chair, it's great to travel with a group of friends. I was going to say it's my security detail, but some said maybe they resembled that remarks, and others said maybe not. But it's great to be here to talk about Ontario Health Teams, and you guys can come on. We'll all just gather around the podium here and share a bit of the work that's happened already. You have received, I think, 2 updates around the work of Ontario Health Teams today. We're here to provide you with a bit of more detail about what an Ontario Health Team is in preparation for the formal submission that we are making as a community on October the 9th. And it will require council to endorse our partnership within that. So today is a little bit more of a deeper dive. But this is a broad, it's not a city initiative, this is a broad community initiative, and as such, there are a number of people that are going to join me and help out with the presentation today. Dr. Tom Stewart is here, he's the CEO of St. Joseph's Health System and Niagara Health. Rob McIsaac is here, the President and CEO of Hamilton Health Sciences. Terry McCarthy is here, the Executive Director of the Hamilton Family Health Team. Dr. David Price is here, Professor and Chair of the Department of Family Medicine at McMaster University. He was also instrumental in creating the Family Medicine Health Team at McMaster. And Bernice King is here. She is the co-chair of the Hamilton's Ontario Health Team process. She's also a patient advisor within the healthcare system. And then, of course, Dr. Richardson and I will be sharing some of our remarks as well. In terms of a brief history of time, Ontario Health Teams were introduced as part of legislation that came forward earlier this year that did a couple of things. One of the things that you have heard about is the creation of an entity called Ontario Health. It is colloquially referred to as a super agency, but I think the province would prefer we just call it Ontario Health. And it is bringing together some of the more provincial organizations to deliver it as one single entity, institutions such as Cancer Care Ontario. There was also within that legislation the development of provider-driven health teams to integrate health and social service organizations at a regional level, and that is what we're here to talk to you a little bit about today. There was a sense of how many of these there would be across the province, but that number has become very fluid as communities are embracing the approach and the opportunity to gather together as providers at a local level to look at how to better integrate health and social services. The reforms that are encompassed within this legislation really do aim to achieve the quadruple aim, which is really about better patient and caregiver experiences, better patient and population outcomes, better value and efficiency, and better provider experience. In terms of the local transformation, what we're here to talk about today really is the Ontario Health Teams. And here on the slide you have, at a top level, some of the key aims of what an Ontario Health Team are. And it really is about coordination, collaboration, and a desire to work together to improve the health of an entire population. And this is very much in line with what Dr. Richardson and myself have shared with you about the view of what keeps us healthy as Hamiltonians, and in the absence of some of these things, what makes us sick. And that is that environment matters to our health. Genetics matters to our health. Access to our healthcare system matters to our health. But the vast majority of our health is driven by the conditions of daily living: education, child development, housing, income, inclusion, and community. And so this approach of Ontario Health Teams to look beyond the actual transactional behavior of health and actually look at how we improve the health of an entire population is something that aligns very much with the work of our Board of Health, but more broadly, the work of our community. From an Ontario Health Team perspective, in terms of what might look different, this is the best graphical representation we have. This really is about, for patients and those who must engage with services of various ilks for their health and well-being, that instead of acting and interacting with each distinct silo, which is trying to do the very best that they can, instead all of those providers would really find a way that it is much, much easier for patients and those in need of services and supports to feel that it is more about the services wrapping around them than them having to access the services. This, again, is nothing new. Around this table, we've talked about this and have been part of partnership projects or initiatives of the city itself that have sought to do this kind of collaborative and integrative work. But this would take this to the entire city level and involve many more partners in helping to deliver that. The fact that the patient is at the center of this model was something that we embraced as an Ontario Health Team Partnership Council very early on. And in fact, in Hamilton, and I believe this is a relatively unique approach to Ontario Health Teams across the province, the co-chairs of our Partnership Council are both themselves patients and patient advisors within the healthcare system. John Fleming is not able to be with us today. He's enjoying time with his family and in particularly celebrating the 70th birthday of his wife. But Bernice King is here, our second co-chair of Hamilton's Ontario Health Team Partnership Council. And I'd like Bernice just to share a little bit about the role that she's playing within this group of service providers and also the importance that patients are playing in the development of our Ontario Health Team application. Bernice?
Thanks, Paul. As mentioned, I am a patient advisor who co-chairs the Hamilton Health Team Partnership Council along with John. I'm a patient advisor also at St. Joseph's Healthcare, and in 2017, I became a member of the Ministry of Health's Long-Term Care's Patient and Family Advisory Council. And this is the first province that has actually had a ministry PFAC. When the province shared their vision for the Ontario Health Teams, which included 24/7 access to care, coordinated care, help for patients to navigate the system, digital tools, patients really want their own chart, and seamless transitions to different care settings, I knew I wanted to be a member of the Hamilton Group. The early members of the working group, which Paul refers to later in the presentation, decided moving forward that they wanted 2 patient advisors to chair the group. Based on the principles outlined by the ministry, there is a strong patient focus. It seems only logical to involve patients from the beginning. However, it was a stroke of genius on Rob McIsaac's part to have advisors to co-chair the group. I believe he had a sidebar with Tom Stewart, and they decided, yes, that's a good idea. And so John and I are co-chairing this endeavor. Having been an advisor for St. Joe's for 4 years and 2 years at the ministry, I understand how care improves when patients are involved in the planning and design of systems. As we are progressing to submit a full proposal, we've kind of multiplied. We actually have 15 advisors now from various organizations that were the initial signatories on the Hamilton Health Team submission. Hamilton Health Team is leading the way in patient partnership, and I am proud to be a member of the team.
Thanks, Bernice. In terms of the vision the province has for Ontario health teams, and it's a vision that we share within our local group in terms of feeling that it's an appropriate vision for the delivery of health and human services in this community. You see on this slide a number of the key elements when Ontario health teams are at what they call full maturity. It's important to note that this will be a journey. Despite what we may hear and read and think, there is no possible way that within a few months or even a couple of years that all of these items will come to full fruition. So we're being asked as communities across the province of Ontario, the 31 who were selected to move forward to a full submission, to talk about the steps that we're going to take in order to get to this full vision. So we're articulating what those first steps will be now, and sharing within our team ideas about how we can not only lay out how we can make some progress in the early stages, but how we can work towards something that, when you look at this particular slide, would be a very different looking system of health in our community, and one that would better support outcomes and better support patients themselves. In terms of the context of who's standing up here today and the role of the city and others in starting us on this journey here in Hamilton, it's important to note that this builds on work that's been happening in Hamilton for quite some time. You have heard around this horseshoe about the Hamilton Anchor Institution Leadership Group. I have the pleasure of co-chairing that group. The city is represented by our city manager and the medical officer of health as members of this group. And they have been doing collaborative work amongst anchor institutions for about 8 years now. An offshoot of that group that started up a couple of years ago is the Hamilton Community Health Working Group, who actually articulated many of the things that we see in Ontario health teams today. They have been working with a view of how the health and well-being of a population can be improved and how we can better work together. So it only made sense that we built on this work in this community, and quite frankly, it has been fed back to us on a number of occasions that it is clear that we have a collaborative working environment in Hamilton already. We didn't just throw it together for our first submission to the province in May. In terms of the initial folks that came on board to help us deliver what was called a self-assessment, it was the first step in the application process. Listed on the screen are those that were actually signatories to that document. I can tell you that this does not represent the sum total of who will be involved as we move forward. We've recognized right from the beginning that others need to be involved and continue to do that today. Bernice shared with you the number of additional patient advisors that we've brought on in addition to John and Bernice. But I can also tell you that we've broadened our collaborative already to include groups like the Bob Kemp Hospice, the Centre de Santé Communautaire, a number of family physicians, recognizing that our early work was not comprehensive enough in our community. So I talked about the steps we're going to take, and slide number 8 shows you that not only are we looking at the healthcare system and how it will interact and be better collaborative in the future, we're also focusing on some key priorities. And we were asked by the province, and all applicants were asked, what are some populations that you would prioritize, really to test out some of the new ways that you would work together? And in Hamilton, building on the work that has come out of not only our data from our healthcare providers, but also from our public health unit, we identified that 2 priority populations made a lot of sense in the Hamilton context. And they are individuals, and this is individuals across an age spectrum with mental health and addiction concerns, and also seniors with multiple chronic conditions. This fits in with who we are from a population perspective as Hamilton, and it also fits in with many of the conversations that we've had around this table. And so I'm going to pause on this slide and invite a few of the guests that we have here today to talk about how this is playing itself out in their context and the way that they see themselves fitting into this Ontario Health Team work. So Rob, I'll ask you to come up first and share a few thoughts from Hamilton Health Sciences.
Thanks very much, Paul, and to members of the board, thanks for having us here today. I'm going to speak very briefly. Very generous of Bernice to ascribe a stroke of genius to me. I just say after 25 years of public service, I feel like I was due. So maybe I'd just start by saying Hamilton Health Sciences is one of Ontario's largest health systems, is very proud to be part of this initiative. While we are a regional provider of services, we've never forgotten our commitment to this community. So this falls very nicely in line with that ongoing balance that we strike to achieve. We are fully committed to the success of the Hamilton Health Team. We know as well or better than most that innovation is totally required in our current health system. The current system is plainly unsustainable given the trends that we're facing with an aging population, the rise of chronic disease. Those trends will only continue, and so we need to find new ways to make sure that our community is as healthy as it can be. This initiative is really consistent with the big directions in Hamilton Health Sciences' strategic plan. So we have said population health and strategic partnerships are definitely the way forward for us, and this is a great manifestation of those things. And as Paul rightly points out, this is very much a continuation of the work that's been going on over the last number of years. I think it's worth pointing out that where this initiative stands today really places Hamilton among the vanguard of communities and cities in the province. People keep telling us that relative to other initiatives, OHT initiatives across the province, Hamilton is highly advanced. And that, I think, is a real tribute to this city and to the culture of this city. So kudos. I should say, as always, your staff is absolutely top drawer, and we love working with them, and they are doing an outstanding job. I think this initiative for me really reminds me when I was back in the day when I was sitting in a seat similar to yours. I remember seeing David Crombie give a speech where he talked about the connectedness of communities and how communities are really fabrics, and you can't pull in any thread of that fabric without impacting all of the other parts of the community. And so in many respects, we are really in the same business. We all want to have a healthy community here in Hamilton, and we will only achieve that by knocking down those old silos, recognizing the interdependencies between our various mandates and working better together. And so that's what this is all about.
I'm Tom Stewart. I just want to also thank you for the time to be here and allowing us to be here. Much appreciated. Also a huge shout out as well to Paul and his team. Been incredible to work with. I didn't know you before this, but it's great to have gotten to know you. So I'm CEO of St. Joseph's Health System and Niagara Health. Many don't know we stretch from Guelph to Kitchener to Brantford and into Hamilton. In Hamilton, St. Joseph's Healthcare Hamilton, the Villa in Dundas, and St. Joseph's Home Care. And I also happen to be CEO of Niagara Health. I am extremely excited, having worked here now for 5 years, about the opportunity here in Hamilton. I absolutely believe that we have a tremendous opportunity around the economy and the health of citizens working in not only this city, but in this region, given our our responsibility for regional programs. I view it as the Pittsburgh of the North, a city that's regrouped itself around health and health sciences, and I see this as a huge opportunity for us, and I am extremely excited about what we're doing here. If you can imagine the future, mental health and addictions, patients with mental health and addictions, which is a growing problem, the frail elderly that are wanting to live and enjoy their life at home, this is only going to be increasing across Ontario. And I think if you could imagine that we actually fix the system, so one call solves your connection into the system, not only by the patient, by their family, and by the healthcare providers. And everyone knows that mechanism. That's what we're striving for. And that's what's been happening in the past when we talk about integrated care at St. Joseph's, something that we've been wanting to do and make it the nature of our business. But this is going to go on steroids by working with our so many partners across this Ontario Health team. I want to echo Rob's comments. I know that we're ahead of other cities in this province in terms of our coming together. You can just look at who actually got the acceptance to go on to the next phase of the application. We are leading the way. The feedback is constant that we are a leading city on this, and this is going to define us in the future. Regardless of what happens with provincial governments or Ontario health teams, this pool of wisdom of these great groups coming together is going to drive Hamilton even farther forward than it is already, and I'm excited to be part of this incredible group. Thank you very much.
Thank you, and thank you as well for allowing me to say a couple of brief words. I think the two defining characteristics of these Ontario health teams are partnerships and integration. And the city and McMaster has certainly demonstrated that with the building across the street here. So I'm David Price. I'm the chair of family medicine and in the Department of Family Medicine at MAC. And when we came here and partnered with you, the city, and had public health collaborate with us and co-locate, which is actually really unique still across Canada, having public health and family medicine in the same building, working and collaborating together. The outcomes, we talked about it when we were here 5 or 6 years ago, and I think it's far exceeded our expectations. And just from a family medicine point of view, since we've moved here, we were just under 15,000 patients in our family health team at this site. We're now just under 20,000 patients rostered, so almost 5,000 patients in the last 4 years, the majority of whom did not have family physicians. And what we've recognized is we see those patients 5, 6, 8, 10 times in their first year. We see them 4 or 5 times in the second year, and then they're down to the usual 3 to 5 visits in the third or fourth year. So really having the services, having the partnership with public health has made an enormous difference. But we also know that it's not family medicine and medicine per se that's made a big difference. It's the ability to partner with our social service colleagues and really provide that wraparound service to our patients. And in primary care and family medicine, we interact with tens of thousands of Hamiltonians every single day. And what, of course, drives the numbers into various places, as Paul alluded to earlier, is not the medical services that they receive, but it's their social environment, the social services, the housing, the food security, the poverty that makes an enormous difference. And we think that that's what working together in these Ontario health teams is really going to accomplish. And so if you think about what we've accomplished just with this one building and this one partnership between us and you through public health, I think the potential to integrate here with social services, public health, the hospital sector, primary care is enormous. And I think you will see a transformation of healthcare. And to me, I've been doing this for over 30 years now. And from my perspective, this has the potential to be the most transformative healthcare revolution that we've seen in this province and in probably this country, certainly in my lifetime. And it's a unique opportunity. So I too want to echo how excited I am to be a part of that and to working with folks, not only here, but all out in the community. So thank you.
Thank you. I'm Terry McCarthy. I'm the Executive Director of the Hamilton Family Health Team. It's the Family Health Team that gets little recognition because we have a very small marketing department. However, we have 166 family docs. They're care teams made up of nurse practitioners, registered nurses, physician assistants, pharmacists, mental health counselors, registered dietitians, physiotherapists, psychiatrists, collectively supporting almost 300,000 Hamilton patients. Our mission is to build clinical and planning capacity in primary care and support the ideals of the patient's medical home. We value timely patient access and quality team-based care. We're eager to participate in the OHT initiative because we see it as a meaningful opportunity to build on some of Hamilton's recent efforts to better integrate the planning and delivery of health and social services in this city. The 2 iterations of Code Red compel us to do better with the resources we have, to direct care where it's most needed, to eliminate duplications, and to partner more effectively. We're also well aware that hallway medicine is a concern in Hamilton and beyond. We believe that better access to primary and social care upstream and primary care and home care post-hospital discharge will improve patient flow and make a contribution to reductions in hallway medicine. So we look forward to working more closely with the city, with the hospitals, and other local human service providers to reduce inequitable health outcomes and improve access to and accountability for Hamilton's healthcare. Thank you.
The principles of our submission are really captured in 4 major areas. And as we have mentioned along the course of this presentation, we really are looking at embedding the patients in the development of this. It is a voice that needs to be heard as we look to change. We need to expand our reach across the community, invite more partners to be there. And then we also need to have these access to these records so that there isn't the gaps between people having to either tell their story several times or missing pieces because we don't have that integrated approach to information. But I'll tell you, I get asked to be part of a lot of groups. So the question for me is always, why dedicate time and energy to things? What does it do to align the city's goals and your goals with the work that's happening in our community? And here, I just wanted to illustrate on this slide, and I'm going to have Elizabeth talk in just a second from a public health perspective. But this is something that has a lot of what's in it for us as the city of Hamilton. Today, we are providing care to over 400 frail elderly individuals in our long-term care facilities. Hundreds of people will visit emergency shelters that are funded through the City of Hamilton. Over 1,000 residential care facilities are both inspected and licensed under our bylaw regime, and almost 780 of them have a subsidy agreement with the City of Hamilton. We're responsible as a service system manager for over 14,000 units of social housing, many of which come with supports. And those are just a few examples of the kind of work where there is an absolute intersection with the healthcare system. And as we go on and talk about our early learning work, our work with young people in the community, our recreation services and our senior centers, you can see all of the connections that happen from a city perspective. And I will say that we lag behind in the ability to provide the right kinds of support for the folks that we support in those systems as a municipality, because we simply can't fund the services that are necessary to keep people healthy and well, nor can we, under the current regime, have the right kind of integration to make it work. And then, of course, we have some of these big ticket items that we've been talking about around this table for quite some time, mainly around one of our services, which is paramedics. It's easy to talk about little ways that we can perhaps move patients a little bit quicker through our system of transportation and delivery and the care that we provide as paramedics into the hospital system. But really, it will take a much broader approach, such as is suggested under the Ontario Health Teams, if we really are to make some difference. And I think of pivoting when you talk about regionalization potentials around paramedics and public health are actually supported by the Ontario Health Team. Instead of talking about regionalizing services that we know work better when we have a local connection, why don't we start talking about how these are partnered locally with our Ontario Health Teams? But I wanted Elizabeth to sort of give the last piece in terms of why these services are important before I talk about timelines and we get to some of your questions, and just share why this fits in very well with the work that Public Health have been doing for years, and why, quite frankly, we keep bringing this topic to the Board of Health from a governance perspective at the City of Hamilton. Elizabeth?
Thanks, Paul. And good afternoon, everybody. It was probably about 4 or 5 years ago when we were here talking at times that I started to talk about how things had really changed, how there was a real difference in terms of the feeling in Hamilton and the partnership and the collaboration. And I think what you see here today is just how much it's changed and just how much commitment there is across the whole system. It's an important thing for all of us service providers, for all the community members. You've heard from Bernice about the Made in Hamilton way, with our leadership coming from our patient care advisors and having that embedded throughout the whole approach. But it's a very important opportunity to draw together all of the resources, the tools, the intelligence, the information that we have across all of our healthcare, public health, social systems here in Hamilton, and look at how we can help people to build strong foundations, how we can help people stay healthy and well along the way, and how we can help them when they have issues that involve healthcare or social services as they go. Paul and others have talked about the social determinants of health, how about 50% of what keeps us healthy, and I like to turn it around as opposed to not what makes us sick, but what keeps us healthy is those social determinants of health. Our jobs, our income, our housing, our early childhood development, those are the things that most impact it. 25% comes from healthcare, about 15% from biology and genetics, and 10% from the physical environment. And we know too that those social determinants play themselves out over the life course. We know that early on in children's development, we get a 9-fold return on what happens there. We know that as they age, we need to keep on going. It's not enough. We don't say to a toddler, good, we got you off to a good start. We knew those first 3 years were important. Off you go, you're on your way. We know we need to support them as they grow, give boosters, as I like to call it, about how did we interpret what coping and resilience means as we grow. But we also know that no life is perfect, no part of society is perfect, there's no such thing. That there are going to be issues, there are going to be challenges that go along the way, and how do we best support them as we move forward. So here we have a very strong understanding of those things amongst this partnership group, and Paul started to get into it a little bit about the issues of health inequities here in Hamilton. You've seen and heard about the issues from Steve Bust and Code Red. You've heard it from all of us in public health too, about how, yes, our society does indeed actually continue to get healthier, but the disparities grow. And I'm very proud to say that this group understands better than any I've probably encountered the issues of health inequities and how they play themselves out here in Hamilton, and the commitment to change that. For us in public health, our role in regards to the health team is in part that providing of information, that population health assessment data that you see from us and that we share. We have a fabulous group of data researchers and intelligence people, from Sharon Pearson at Hamilton Health Sciences to the researchers at McMaster who've joined in, and they all work together to bring that information and data together. We also, and I was very glad to see at our coordinating committee, we have the whole idea that there are tools that go beyond care that can address how healthy people are and address that upstream piece of what we can do. And so that's part of what public health brings to the table as well. It is those things that are looking at what policies do we need, what legislation. You think about things like tobacco bylaws, you think about the communications work we do, whether it's around smoking or West Nile virus. There's all sorts of other approaches and tools that we can bring, and we're bringing those to the table as well. The last piece that we have, of course, is the direct clinical services that we provide. So we provide a number of clinics, sexual health clinics, mental health services for children, and addiction services for adults, and dental services. And so looking at how best to coordinate those with this group is an important role for us as well. So as we go forward, just to think again about that analogy of the river. And so while we're trying very hard to stop people from falling in earlier in life, We know we need to have a really good system of supports to stop that from happening, but inevitably along the way, they will happen. And through the coordination that happens with our health and social services that this team represents, we can do a very good job at improving that care and treatment. Thanks. Back to you, Paul.
Just wanted to provide you with a sense of timelines. From the opening of the calls for the self-assessment, round 1 of applications, to the deadline for full submissions is 6 months. So we've been working at a very quick pace to get our community prepared for this and start to have some of those very serious conversations. So you can see the gates that we've passed through already. You can see our next deadline, which is highlighted for you in red. The submission of full applications does require that the organizations that are part of this collaborative work do endorse that through their governing bodies. And so we will be back in September because unfortunately the only ratification at council that we can hit prior to October 9th would be coming to our September Board of Health meeting. And we will be here to share with you what we see as the next level of our application. And then, of course, the province will announce sometime in the fall who has been successful of the 31 that were invited to submit full applications. These are some of the things that are happening next. We are deeply embedded in this because we wish to be part of the discussions about how the health system is structured and the interactions it will have with our critical services here at the City of Hamilton and the services that we fund through nonprofit organizations that receive their funding through the City of Hamilton. We also want to understand how it will impact our funding, because we deliver some critical services, and some of the services that we provide will be part of the Ontario Health Team's model, regardless of whether we participate or not. Things like long-term care will come under the umbrella of Ontario Health Teams. So it behooves us very much to be part of this initiative from a practical perspective, and I believe that we have lots that we can add from a leadership perspective to help make this work. We'll pause now. We're here as a team to answer some questions if you have them, and then happy to see you again in September with more information about our actual full submission. Thanks very much.
Thank you all. Certainly this is a very encouraging development, and certainly a testament to the time and talent of everyone there, with the special acknowledgement of Ms. King and Mr. Fleming. We do have some questions. Councillor Clark.
Thank you, Madam Chair. I appreciate this. Let me start by saying that these are some of the most innovative and high-quality professionals in the healthcare system that I've seen in the province. So I'm lucky to have them in Hamilton, and I really appreciate that. Mr. Stewart said he's extremely excited. I'm extremely apprehensive. I'm a little bit nervous because I'm trying to understand. We went from a CCAC to a LHIN, and now we're going to the OHT, and I've not seen, in the document it talks about a standardized framework. So be measured, report on, and improve performance across a standardized framework. So has the province provided that to you, or do you have to create that?
I'll maybe make a few comments, but my colleagues may, just because you kind of directed it at me.
Unintentionally.
So, am I anxious? It would be wrong to say I'm not, but I don't show it, right? I am excited because I think in the lack of clarity, there's often a chance for leaders to come up the middle and lead. And I think we have the team here that can lead. What are my personal views? I think they're, as we develop and as potentially 31 OHTs come together, I personally believe that there will be merging of some of the direction of OHTs, and rather than regional office, it's possible that there might be some larger OHTs that come together. But in the interim, here is our chance to lead up the middle. We have the bench strength in Hamilton, and we can set the tone for the rest of the province. I think the ministry is looking to us in a lot of ways right now. I would be wrong to say I don't have some of the trepidation you have, but that's life.
I appreciate your candor and your diplomacy. It talks about a clear accountability framework. Is the accountability framework that exists today being blown up? We have healthcare professional colleges that hold their own professionals, nurses, doctors to account. Then we have the Hospitals Association, we have long-term care. So how is the actual accountability framework? And again, are we creating that? Or is the provincial government, because the accountability framework already exists. We hold all of those institutions to account right now through rather long accreditation processes. So I'm trying to understand what that means, a single clear accountability framework, which seems incredibly challenging given the breadth of what they're holding accountable.
Sure, and through the chair, it is challenging. The accountability we're talking about would be at the local level of those service providers that are delivering care. So our role as an Ontario Health Team is not to look at an accountability framework that would include colleges or things of this nature. We will be providing some feedback through our application of where we see the government needing to make some changes to allow us to do our work in a more integrated model. Each of us will show, if I use paramedics for an example, we have plenty of things that we can demonstrate where there is a gap that holds us back from delivering service in the way we would love to, with great care for the patients that we transport, but cannot due to the legislation or the regulations not yet being enacted. So we will provide some of that feedback. The accountability that we share in these slides is about the accountability to each other and the way that we would deliver service. The government is asking us to put forward our ideas on governance. They are not putting forward a template on governance for us to look at. And if you read the article with the Minister of Health, she was very clear that there's some transparency goals that she sees as absolute, but in terms of how that governance will work and how the accountabilities will flow, we are creating some of that at this particular moment. In the early stages, not a lot's going to change in year one, but over time, there needs to be a path to a different kind of accountability. So we struggle. I actually sit on the governance working group, and I have less hair than I did when I started here a number of years ago, and I'm going to have a lot less even by September, because governance is where it's going to be made or make or break time, and we don't have a framework, and we're trying to figure out how that governance will look without disrupting care. So we are not dealing with a system that we're starting, of course. We're dealing with a system that operates today. So we do know just a few things. We know some of the services that will be encompassed within this, things like long-term care. We do know that home care responsibility will eventually be transferred, although not necessarily the contracts themselves with the providers. That will be held with Ontario Health. So it's a long way of saying there are some accountabilities that we can work on, and that would be the local context of how agencies work together. There are other things that we would be suggesting to government and then in dialogue with them over time, and there are some that will take years for us, I think, to fully unpack and change.
Sorry, Mr. Johnson, community care, you mentioned it would be under Ontario Health?
The information that was stated that the contracts for some of that would be under Ontario Health, that would not be a local responsibility at the contract, but how the delivery of home care works. We're still trying to figure out where that difference would be from a contract holding perspective versus a service delivery perspective. That could be through service level agreements, it could be through a variety of forms, but we did hear that information shared that it's not their expectation at this stage that those individual contracting and procurement work would happen at the OHT level.
Madam Chair, that leads to my last question. So it talks about an integrated funding envelope. So based on that statement, it sounds like community care is going to be funded from Ontario Health and not from the local health teams.
Mr. McIsaac.
I think so much of the hard work to answer the questions that I anticipate many of you will have is currently underway. And so, Councillor, you and I had a brief conversation before where I was saying, there's no playbook for this. We're doing this for the first time. And so we're not trying to be evasive. We're trying to work through the very questions that you're asking. I appreciate the context or the place you're coming from. I agree, there are all kinds of accountabilities currently in place. But I would also say, who's accountable for the lack of progress that's been made on Code Red over the last 10 years? In some respects, it's all of us. But sometimes when everybody's accountable, nobody's accountable. So we need to think about the broad indicators that matter to this community and hold ourselves accountable to them. And I think that's the work we're trying to do now. The fine details you're asking about, the honest answer is we don't know yet.
So the integrated funding envelope, I guess we're needing clarification at some point, because you have family docs that are getting money from OHIP, we have hospitals that are getting money from, well, it was the LHIN, now I guess it's the ministry. And all of them have seen increases of, or let me rephrase that, pressures of between 2 and 6% a year, and they've been getting less than 1% a year. Now we have an integrated funding model, but we don't really know who's going to fall under that funding model.
Well, as of today, we don't know the answer to that, but I think the challenge that's on the team today, so I guess the first point I'd make is where we start will not be where we finish. And I think for year 1 and year 2, we need to come up with things that we're comfortable holding each other accountable for, and that's the work that's currently going on. But I do think that, and I can't speak for the ministry, but I expect where they're headed is that 10 years from now, the accountabilities will continue to grow along with the integration that goes along with them. So I expect this will be an ongoing dialogue for many years to come.
And I expect that they're looking for financial efficiencies through the process too, and
absolutely,
it's going to be a real challenge. So I'm supportive of the team. I really am. As I said, I am trepidatious. I just there's such a huge lack of detail from the province, and it's very unusual to say, you know what? Here's our healthcare system. You fix it, because that's in essence what they've done.
Although. Councillor, through you, Chair, I would just say, if they had told us everything and how to do it, we would probably be standing here today saying there's no sensitivity to what's happening in the local community. They're trying to control everything from Toronto and, typical province. So this is atypical for sure. It's scary, but I say let's grab it, Chair, and see what we can do with it.
Thank you, Mr. McIsaac. I appreciate your candor.
Question from Councillor Ferguson. Councillor Whitehead, are you next? Thank you.
Thank you. First of all, I'm not clear just to define the scope. This team, the catchment patient population is what? And what is the geographic area? Let's define that first.
So through the chair, as a team, we're really talking about the city of Hamilton. I will say that the province has provided us with a patient profile that is also taking into account where people get some of the care. So there are some patients assigned to the Hamilton Ontario Health Team piece that come from just outside our boundary areas, thinking about just into Burlington, just into Grimsby, those folks. But that would be about where they're receiving perhaps their primary care and other things. But our team is focused on what this system and the accountabilities within the system would look like for the city of Hamilton.
So I don't know, I'm trying to understand true integration when you're talking about something that's so narrow compared to the fact that we currently serve over 2.5 million population in regards to the health services that are currently provided. So there's a dramatic departure from what we're currently doing and what you'll be looking at, and I'm not sure how that is a better integration model in regards to healthcare. So this is really truly localized kind of solutions we're looking at in regards to healthcare, because I always thought healthcare was much more broader and comprehensive. So it's a bit confusing that you're telling me the scope is much narrower than the current services that we're providing.
Through the chair, in terms of the integration, and others will chime in because, of course, our two hospital systems are, as you say, a broad regional piece. This is happening at multiple levels. There are some things that are going to be provincially driven, and Cancer Care Ontario would be a good example of that. They have lots of role to play, and that is going to be provincial, not at an OHT or even at a multiple OHT level. And then there will be things that will continue to be regionalized. In terms of what this team is looking at in how it might better integrate some of the services that connect social services and healthcare services, we are really taking that City of Hamilton approach with a bit of fuzzy edges for those communities that butt right up against the city. But the other piece the province has said very clearly is they want us to work with other Ontario health teams so that they understand some of those connections. But in terms of regional programs and regional services,
There's not going to be a change to some of those, and maybe Tom and/or Rob can talk a little bit about how that plays out practically, because they're actually part of multiple OHT applications.
Just for clarification, the reason I'm asking the question is hard to imagine that the regional performance of our healthcare system, especially our hospitals, doesn't have in some way or fashion some impact in the context of the service we receive in this direct community. And there's a disconnect, we believe otherwise. So I'm a bit confused on how you can do both and do it appropriately.
So we're not going to boil the ocean right at once, and I think this echoes Rob's comments. We're going to start in certain areas. Ontario Health Teams are largely focused on the community service stuff like primary and secondary care. When you think of hospitals like I do, we're thinking a lot of our tertiary and quaternary services. At this point, those regional programs like kids and cancer and heart and dialysis, lungs, will be funded directly from the province and have some standards through Ontario Health. At this point, we're trying to build up what happens in communities, and the big eye-opener for us is that, as you started off, a large part of our care and our health depends on what goes on in those early phases and in the social determinants of health, and this is what we're coming together to solve. The big issue, the big difference is we're actually having a mandate to bring partners together, and I think that is one of the early things. And if it's okay, Chair, with the previous councillor's question, when teams have come together under bundled funding or bundled care, surprise, surprise, the experience across most of the world is that savings are found, care is better, patients are happier, and caregivers are also happier. So something does work when you talk about bundled care. Our experience in Ontario so far has largely just been for defined areas in the acute care sector. And now we have an opportunity to think about bundled care much more broadly. And you're right, we're going to fail a couple times going forward, but as Rob alluded to, I think we're going to have some great successes by this group coming together.
So I appreciate that. I'm really happy the fact that you identified what I see, although there's a piece missing here, and I was surprised considering the amount of money and time we spend on the issue that it's not part of the fourth thing identified in the parcel that you identified. So you talked about youth, adult, mental health, addiction. Absolutely an issue that's growing and a growing concern. You talked about complexity of senior care, absolutely, without question, and especially with the growing population of seniors in the community. But there's something unique from community to community in the context of poverty and low birth weight babies and all those other determinants of health that aren't necessarily equal from industrialized community to to an Oakville, to a Burlington, and so forth. So I'm trying to understand how you. How come that piece is missing in that piece?
Well, through the chair, we were asked to identify a couple of populations that we would demonstrate some different ways of bundling care and partnering care. Does not for a minute suggest that we are not looking at other issues that are in front of us in Hamilton. And in fact, as you've heard mentioned a couple of times, things like Code Red, which is those differences between care. Things like our geographies where there are frequent users of healthcare services that require a different type of intervention, not just more effective or efficient delivery of a service, but a different kind of intervention, are very much top of mind. And in fact, we just had a workshop with, I think, over 100 people, Jeff, that came out to participate. And many, many times, exactly what you were talking about was raised. So we believe within the context of some priority populations, I think it's been hard to identify a couple of priorities because I get this question a lot, and I always say it's both and. We're looking at a number of things that challenge us from a health and well-being perspective while also using a couple of demonstrated population groups to say how would we deliver things in a bit of a different way. Your comments, though, are I would say very much in line with what we've heard from community partners, and I appreciate that we should somehow articulate that so it doesn't appear that it's
the reason I'm raising is what makes us different and the challenge is greater from one community to another And some of the things identified is probably pretty consistent with many of the larger urban centers in Ontario. And I don't think it might be a little more acute in one community than another, but they're all pretty similar. But what really distinguishes some of the communities from others is the poverty and the determinants of health issues that are the outcomes from the poverty situation that not all urban communities are equal, not even come close to being equal to. And when you identify those 2 or 3 categories, I was just surprised that Hamilton has one of those. We're in that acute situation, and yet we don't put it up there and fly and say this is part of the public health strategies and understanding that we need to incorporate in this whole broader conversation.
Yep.
So the last piece is the, I want to thank the hospitals and their contribution to the physician recruitment. But the bones on public health is the family physicians. There's no question about that. And currently in Hamilton, we have a shortage on the mountain of 20 family physicians. We have problems with the modems. We have problems with the payment models. So I would hope, and I don't know if this is part of your conversation, but I'm hoping that those kinds of things, those impediments to access to direct health through family physicians is a problem in the city of Hamilton. I'm wondering if that is going to be part of the work that you'll be dealing with.
I'm going to ask either Terry or David to get into a couple specifics. I will say that a primary focus of our work is around how primary care, the hospital systems, and community care and home care systems can work better together, and we can tackle and address some of those barriers. That is the specific tactical work that we're talking about. But in terms of the physician shortages and some of those other barriers, I think David's going to address some of those.
Thank you. Through you, Madam Chair. I think there's 2 points to this, Councillor. The first is I think Paul articulated the quadruple aim, which is provider satisfaction. And we know that one of the real frustrations and challenges for family physicians is when you get a patient who is in your office with a particular problem, it's often really difficult to navigate the system and figure out how to get them into the specialist or the social services. And as an individual family physician, that's not really what you're trained for. And so part of this working together, we feel can make a big difference to that frustration, which hopefully will help us to both retain and recruit family physicians. It's also been really clear that the more you work as a team and the more you work as an integrated team, the easier it is to retain and recruit young family physicians. I think Across the Way is a perfect example. We turned down 8 physicians in July that asked to join our team. We don't have the capacity to bring on 8 at once, so we continue to bring on 2 or 3 new family docs every year. And I think the question is why? It's because it's a collaborative team-based model. And we know that's what works, and that's really where we're driving towards at the system level. And I think the last thing is in terms of, you alluded to the payment models and the challenges with FOs and are we underserviced or overserviced. There was a whole email exchange that happened today, and I think that's something that we as a collective will continue to need to press the ministry on, is that let's move to a system. And certainly with the latest arbitration award, there is a committee whose task is to look at that and report back by June of next year. So it's one of those areas that's top of mind.
Appreciate it. Thank you.
Thank you. Just a gentle reminder to members of council that we do have a 5-minute to guide our questions and our answers, and we understand that this is a very complex initiative, new waters, but if we could be focused in our questions. Thank you. Councillor Ferguson.
Yes, thank you. And it's been a long time since we had this kind of healthcare horsepower in the council chambers. And I don't get an opportunity to ask questions, like high-level questions. And we have a lot of things across our plates, from public works to planning to audit and administration and emergency community services and healthcare and so on and so on. So listening to you today, and probably Rob or David are the best person to ask this question to, is, am I sensing, because the provincial government has got a lot of criticism lately for things they're doing, whether it's autism or transfer payments for healthcare in our community, our health department, we're seeing a a $20 million cut in our transfer payments for the city of Hamilton alone. Am I sensing that the healthcare sector, particularly the hospitals and maybe the people who train docs, like taking down the lens, like this change that's happening? And so that's my first question. I've never heard any of you publicly say that, yes or no.
So let me start through the chair, and then others can. I think there is excitement, there is fear, and then there is resistance, and that's change management. It would be the same if we were doing anything within our city departments as well. I can tell you that based on the engagement we've had with community organizations, family physicians, obviously our hospitals here have already kind of answered that question for you. There are a lot of people who do think that this is the time and this actually is the model. And with all the questions still to be answered, actually a chance to jump in and do some things right. And we've had some very intense but positive conversations about things like home care, about how we will change the dynamic between how family physicians work with other systems. So, but to suggest that this is universally loved, absolutely not. And there are some organizations out there that fear that this is going to be some large players within the health system that will simply run over the smaller organizations and not-for-profits, and we will have our hands full when it comes to governance and accountability on this, because they will want to protect, as all of us do, want to protect the work we do. So I would say right now in the planning stage and dreaming stage and setting forward some of those lofty goals, everybody's like, heck yeah, this will work. The reality is we've been told there is no new money for this, and we've also, we'll understand that there's some tougher decisions along the way. So that's the perspective that I have seen from working on this for a little bit. Maybe a couple of our team members can share something along those lines.
I'd like, Rob, you employ 10,000 people in the healthcare sector. When I was on the board, it was always a fight every year. They have no increase in budgeting, but they would give away 3% to the ONA. And you'd have to find it in your system. Nat, do you like the dismantling of the LHINs and going to a larger health network?
I'd rather not comment specifically on the dismantling of the LHINs. Look, things haven't changed since you left. We still have that struggle every single year. Every year there's a new mountain to climb in terms of finding new efficiencies within the hospital. I'm sure Tom has exactly the same experience. What I would say, through you, Chair, is it's pretty clear that status quo is not going to be sufficient going forward. So I'm embracing this opportunity to make change, to try to rise to the challenges that we know are headed towards us, many of which are already here, actually. So we need to find change, and this is a kind of liberation for us to say, the province is sort of saying, okay, you tell us, how can you make it work? And so that is a once-in-a-career opportunity for many of us in healthcare.
Okay. Of course, a lot of us here at the city fear they're just going to push more download to us through this process. And, we don't know those details, but you're right. Healthcare has been in disarray for a long, long time. And it's interesting that I know you need a lot more details, but generally you like the idea of these changes. So does anybody have any idea of where the new boundary would be for Hamilton? What else would it include? Would it go as far as Toronto or Mississauga or down to Niagara? Or?
Well, I like the way Paul said it. The boundary is the city of Hamilton, but it's a little bit fuzzy, and we need to bring some...
But isn't necessarily going to be a lot bigger than the former LHIN, which was Hamilton, Niagara, or Brantford?
So you're, again, asking me questions that I think that we're working on answers to, but I think that there's going to have to be some flexibility in terms of the boundary by service. So I expect that many of the smaller communities around us will not have the wherewithal to manage the services like home care. So I think Hamilton will continue to be a regional center for many of the services, and we'll provide services to surrounding communities.
In pediatric care?
Well, so Yeah, I'm talking about outside of the acute care sector, but for sure within acute care for tertiary and quaternary care, we'll continue to provide those services to communities all around us. How that'll work, to be determined. It could continue to be directly funded by the province. You could also imagine a scenario where one OHT is billing another OHT for tertiary and quaternary services. So, Chair, if Halton is sending us kids that are being dealt with at McMaster Children's, we would submit a bill for those services to an adjacent OHT. I think there's many different models that we might evolve to.
Okay, well, thank you. And David, I'm glad to hear that things are working okay across the road. In fact, I think you said they're exceeding expectation, because that was quite a debate to have City of Hamilton put $20 million into a healthcare facility when it's not our responsibility.
Aren't you glad I'm not here asking for more money today for a change? Yet. And the only thing I would add to your question is, I think the family physicians are really excited. We've had we had an evening and an early morning, of which we had 80 and 70 at each of those events of family physicians from the community. Tomorrow night, we've got a working group, and we've got over 25 family physicians registered. That's at the middle of summer, end of August. 25 community family physicians, not the family physicians from the academic team, but 25 community family physicians who are excited about the potential of reorganizing the system. So, for sure, this is, whether you liked or disliked the LHINs, I think what's exciting about this is it's a chance to start to build a system that will respond to the needs locally.
Because what we used to hear, at least in my community, and I suspect other members of council are hearing the same thing, it was always issues around CCAC and getting home care and what they needed. And I think one of you mentioned that that's going to be reviewed too and handled differently. Maybe it was you, Paul, that did that. And I hope you don't lose too much more hair either. Yeah.
It's okay, it makes me more aerodynamic.
Let's go with that.
So, I'm slower as a referee, so I got to get more aerodynamic in some way. So, through the chair, I don't think there are any more speakers at this point. I just wanted to wrap up and say that we will be bringing back a bit more detail. You will not see in September the 10 year from now what it's going to look like piece, but you will have some significant questions answered. And a bit to a point that Councillor Ferguson raised about, let's not drag the municipality and the property taxpayer into paying for health services. I mean, that's a very important piece. We all have our governance challenges and our governance issues, and I can tell you that Nicole Oddie is actually working with me on the governance working group as well. So she understands very much how this also needs to balance out what our responsibilities are as a municipality. We'll come back with some of those answers for you at the next Board of Health and give you an opportunity to see a bit more detail, a lot more detail actually, in terms of what our submission looks like, and be recommending at that time, assuming all goes well over the next 4 weeks, that we sign on to this as a step in playing our part in the community's healthcare service delivery model. So, thank you.
Thank you. And on behalf of the Hamilton Board of Health, please, thank you for coming out today and spending your afternoon. I know you're all very, very busy people. We appreciate all the effort that you are making and your time. Thank you. May I have a motion to receive the presentation? Councillor Ferguson and Councillor Vanderbeek. On item 9.1, which is Paul's report, are there any questions on that report? May I have a motion to receive the report, please? Councillor Marula and Councillor Clark. Thank you. Received, yep, thanks. Other business. We have the following amendments to the outstanding business list, which are items to be removed. May I have a motion to approve those amendments? Councillor Vanderbeek and Councillor Pauls. Thank you. Electronic vote on that, please. We're just going to do that one again, please. No
worries. Can we vote again, please? Thank you. Thank you, and that carries. May I have a motion to adjourn? Great. Thank you, Councillor Pearson and Councillor Ferguson. Just a reminder to all members that there is a City Housing Hamilton shareholder meeting immediately following the conclusion of the Board of Health. Thank you.